Let's talk about this Precut kinesiology tape for knee pain. Now, I'm a licensed physical therapist. I purchased this. This is not a paid sponsored ad. I'm under no obligation to say anything positive or negative. This is a unbiased review. Basically, what I was looking for was two things. I wanted something to speed up the process of applying kinesio tape to the knee for my patients, but I also wanted something that they could use at home when they weren't coming to physical therapy. Before I made this purchase, I always look at the negative reviews to see what people are saying, and I noticed that several people had said the tape was too sticky and sticking to itself, and it was difficult to apply. To be sure, I applied it correctly. I watched several of the training videos. Now, if you look at this video, you'll see that I did apply it differently. I applied it more in the conventional way we would typically use kinesiology tape in the clinic. But nonetheless, I would say that while I understand the tape is sticky, it needs to be sticky in order to stay on your skin. So if you allow it to fold over on itself, it will get stuck and it's hard to pull apart. But focus on following the instructions and applying the tape as prescribed. The other common complaint I saw was that the tape doesn't provide support. I think it's important that you understand kinesiology tape is not intended to provide support. It's intended to provide proprioceptive feedback in kinesthetic sense so that the user is more aware of where the joint is positioned in space. It also provides a little lift to the skin and support the lymphatic system to enhance circulation, basically pump out the waste products and allow nutrients and oxygen to come into the tissue.